Hello, Representative Raymond Smith. My name is Mark Blizzard. I'm a constituent of District 21. I live in southeastern Wayne County and have lived there most of my life. I've been a nurse for 19 years. The past 6 years I've been an occupational health nurse, and I work alongside of school health nurses. I'd like to talk to you about a topic that is of importance to me as a parent of 3 children and also as a co-worker of school health nurses, and that is the number of school health nurses available in North Carolina. Currently, the School Nurse Association of North Carolina endorses a one nurse per one school ratio. I'm aware of at least one nurse that I work with who is divided among 6 schools, and she is certainly not the exception. There are other nurses who shared 2 or 3 schools or shared between 2 or 3 schools, and their time is divided and they're not always available for one particular school. I've seen several of the bills that have been introduced by the Appropriations of Health and Human Services Committee, which I know you're a member of, that I think will coincide with school health nurses if you will listen to my reasoning. The first one is House Bill 234, which calls for funds for child advocacy. Nurses have been known for a long time to be advocates of both patients, family members, staff, and so what better way to have an advocate for kids in schools than to have more nurses available that can help with child advocacy. The next House bill that I'd like to discuss is House Bill 684. This House bill is intended to create relationships for youth with intellectual and developmental disabilities in schools. Again, if you have more nurses available in schools to help the students, they can develop these relationships with these students who have the intellectual and developmental disabilities. If these nurses are there full-time because they're only assigned to one school, then they have the perfect opportunity to develop these relationships. The last one is House Bill 725, Funds to Strengthen Youth Tobacco Prevention Programs. Nurses have long been known to educate patients, students, family members on different things. Currently, the nurses I work with do a lot of education with STDs and STIs and their prevention. They also do health education, and tobacco prevention is another thing that if a nurse is there full-time at the school because she's not being shared between schools, then she can provide this tobacco prevention education to the students as well as the staff if the staff would desire to have that program taught to them. So I think if you'll look at these 3 different bills just alone and you see the money that would be spent on those bills, you could use that money to increase the number of school nurses and increase that ratio to 1 nurse per school as a minimum, and you would get many of the results that you're looking for in these 3 House bills that you've introduced. I thank you for your time, and I look forward to hearing from your response.